Hi, I'm Amy Shapiro, CEO of the Indiana Hemophilia and Thrombosis Center. I want to tell you about an inspiring program of people helping people. It's my sincere hope that you can help too. More than 15 years ago, we were honored to become part of a program and the establishment of a very special community clinic that is based in northern Indiana. The clinic serves a very special population of individuals with many rare disorders. Through their work, the clinic not only provides direct community-based care, but also advances knowledge and treatment that serves us all throughout the world.
When I was asked to help start this in 2008, I personally didn't have any personal reason to, other than just my interest in genetic disorders. But since then, I've had a family that have severe genetic disorders. And to me, it's these things can be prevented or they can be treated, and you don't know how soon it will be in your own backyard.
The Amish culture is not very different from where I grew up. My grandpa had a donkey buggy, and he took me to school on that buggy, so for me, it felt like coming back home. I mean, I remember my first drive with Dennis Lehman and other people. I was just looking around thinking, okay, this feels like home. I can be here.
I grew up in Pennsylvania, not too far from a large Amish and Mennonite population in Lancaster County. This was a group of people, and is a group of people today. This is sort of overburdened with some really devastating genetic diseases. And with that burden comes the challenge of being uninsured, living in remote rural settings in the modern healthcare system, which is kind of a recipe for disaster.
There's multiple reasons for people outside the Plain community to support this effort. The way healthcare is being provided in our clinic and in our community is unique. It's scalable. It's economically more effective than the way we're currently doing traditional healthcare in the country. It's also clinically effective. So it allows providers to spend time with patients. There's a mandatory interaction between the community and the healthcare provider here. To hold us both responsible to be making good decisions and spending our collective healthcare resources wisely.
My name is Pam Dietz, and I'm the case management coordinator here at the clinic. We make referrals to specialists, schedule appointments, try to coordinate appointments for families if needed, because transportation is always an issue for a lot of our population. And along with that, I have a couple of parent support groups that I facilitate. Those are the most fun part. Yeah, I love to get the moms together.
What I've been able to do over the last 13 years is really concentrate on good health care without barriers. So we're going to get it done without having to worry about whether we need an authorization on an MRI. It just comes down to a family sitting in front of us or the Plain Church Health Group Ministry saying, we need it, let's do it. If my baby needs an MRI, let's figure out how to do that.
I am often asked the question, well, this is all very interesting what you're doing, but why should we really care about it here at Boston Children's Hospital or Children's Hospital of Philadelphia? Because this is really esoterica in medicine. And my response to that is, it's a critical mistake to think about the Amish and Mennonite people as separate from us, as a group of people who are hearkening back to a bygone era. These are modern people who choose to live in a different way. And they have chosen to avoid technologies that erode social interdependence. that erode friendships, that erode families, and instead invest their collective resources in caring for each other. And ironically, a group of people who have chosen to eschew many modern conveniences, like cell phones and electricity, are actually at the very leading edge of some of the biggest innovations in genomic medicine in the world. And people are starting to take notice of that and looking at these communities for leadership in how we can use the best technology to the benefit of real people with real problems.
I am proud of our community. I'm thankful for the opportunity to live here. If you want to help individuals worldwide, I see of no better way than investing in this particular clinic. The community is here to help, and they just do a lot of valuable research, and they have willing participants.
The advancements and the treatment that's providing here can help so many people. And I think this is a gem. This is a beautiful program that people should feel proud to become part of.